Hi everyone, thank you for stopping by again to watch my video. This is Prompt Review and I'm still your beloved Favor. I'm here to talk briefly on some of the HEENT disorders. The first one is Eyelid, also known as tie. What is Eyelid? This is a common staphylococcal abscess on the upper eyelid. So how do you remember it? H goes with H. Eyelid, hurting. So if a patient tells you that this is painful, it hurts, then that is tile. It doesn't matter if it's located at the upper or the lower eyelid. Once the patient complains that this is painful, then that is tile. So what is the cause? The cause is usually a staphylococcus and is very common. The treatment is a warm compress and you can also prescribe erythromycin ointment. But don't forget Eyelid or style. Patient will tell you that it is painful. H goes with H, which means harden. It's very painful, it's hardened, and the treatment is warm. Chalism. C goes with C. Chilling. That means patient will tell you that it does not hurt. So it doesn't matter if it's located at the upper or the lower eyelid, but the difference with chalism and style is that chalism does not hurt. So this is a subacute non-tender, usually painless nodules involving a blocked membrane gland. But remember, the treatment is usually hot compresses and they can also do a surgical removal. But basically, you just need to know the difference between chalism and Eyelid. Eyelid, hurting, H goes with H. Hurting is painful. Chalism, C goes with C. Chilling, it does not hurt. Entropion or Entropion. So how do you remember entropion or enter? From the word enter, inside, goes inside, goes inward. The eyelid is rolled inward against the eyeball. Looking at the diagram, you understand it more. It goes inward, enter inside, enter inward. The eyelid is rolled inward, and this is caused by muscle spasm or inflammation or scarring of the conjunctiva. So there is the lower lashes irritates the conjunctiva and the lower cornea. But remember, the surgery will help to tighten the ocular muscles. Entropion or Entropion. Just remember from the word enter, E-N-T-R, is going inward. It rolls inward. The eyelid rolls inward. Entropion. Ectropion. Ectropion. So this one, the margin of the lower eyelid is done outward. Outward. Ectropion. Outward. Exposing the palpebral conjunctiva. So this is as a result of consequences of advanced age. The eyeward is rolled outward away from the eyeball and there is increased tearing. Don't forget ectropion, outward, Entropion or entropion. That one is what? Inward. Enter inward. Ectropion is outward. What is subconjunctival hemorrhage? I highlighted the portions that you need to take note. This is basically the blood vessels breaks within the as a result of increased ocular pressure, or there is a leakage of blood outside the vessels. It produces homogeneous or sharply demarcated area of redness. You can look at the diagram. So what is that telling you? The patient will basically complain that after they, involved in trauma, which is the T, or sudden increase in venous pressure, maybe like coughing, which is a C, and S, which is straining. So what do you educate the patient? You educate the patient that this is normal and is going to resolve within 2 weeks. They should not panic about it. It is not painful. It does not affect their vision. The cornea is still clear, even though you can see the sharply demarcated area of redness, but it's still clear if you look at the cornea. And also the pupil is not affected. So it's caused by what? Sudden increase in venous pressure, which is as a result of straining, coughing, sneezing. Just remember the letters I highlighted. S can be sneezing, S can be straining, C can be coughing, T can be trauma. Those are the reasons that led to this. Yes, they use the word hemorrhage, but it does not mean that it cannot be, that is profusely showing that it can lead to a complication. No, it will resolve within 2 weeks. Just reassure the patient, it will resolve within. Dacryocystitis. How do you remember dacryocystitis? This is inflammation. Inflammation. Remember, anytime you hear titis, inflammation. But what type of inflammation? This is inflammation of a lacrimal sac. Lacrimal sac, and it can cause obstruction. So dacryocystitis or dacryocystitis. So remember, the inner canthus is affected. There is a blockage, there is an obstruction, and this is as a result of inflammation of the lacrimal sac. Pterygium. Pterygium, how do you remember that? T goes with T. Pterygium triangular. T goes with T. Is T triangular wedge of the conjunctival tissue. It starts on the nasal conjunctiva and extends into the cornea. If you look at the diagram, you will see the shape, the triangular shape. So T goes with T, triangular wedge of conjunctival tissue. Arcus senilis. How do you remember Arcus senilis? It's an opaque ring. R goes with R. Arcus ring. R goes with R. It's an opaque ring surrounding the cornea. Arcus senilis is common with older people. It is caused by fat, which is lipids deposit deep in the edge of the cornea. It's not related to high cholesterol, but remember, if the patient is less than 40 years old, you still have to rule out high cholesterol by ordering lipid panel. So if this patient is less than 40 years old, you have to be worried. So a lipid panel will be ordered. Thank you.